Hello everyone. Today we'll start with the important topic of biopharmaceutics, that is pharmacokinetics. So most of the students find very complicated of this topic, but it's not complicated if you know all the basics regarding the pharmacokinetics. So pharmacokinetic models. So before moving on to the individual models, we must know what the pharmacokinetic models are and what for it is used. So pharmacokinetic models is nothing but a mathematical model. So So we have discussed in previous videos regarding the factors influencing absorption, distribution, metabolism and excretion, which combinedly known as pharmacokinetics. So we just discussed about all the factors which are going to affect those pharmacokinetic parameters. From today we will be discussing in the upcoming videos related to the pharmacokinetics of the drug. Now what is the pharmacokinetics? Again, it is the study of rate of movement of drug in the body. Now how much amount of drug or how much the concentration of drug present in each and every tissues have to be calculated. It is very complex process. It's not that easy to calculate the drug concentration present in plasma as well as in other tissues. So to determine the drug concentration and its change with respect to time, that is the rate, to determine that you need to use some model. So we use mathematics to study or to determine the drug concentration with respect to time or as the time changes. So that is rate. To study the rate, we need some models. That is mainly mathematical models we are going to use to simplify that complex pharmacokinetic properties. So pharmacokinetic model can be defined as it is a mathematical model. First of all, it is a mathematical model. So what this model is used for? It is used to simulate the rate processes. Simulate the rate processes. Simulate means it mimic or it is similar to the rate processes that is happening in our body. The same thing will be simulated with the help of mathematics. So this model simulates all the rate processes. What are the rate processes involved in the body? Absorption, distribution, metabolism and excretion. So these rate processes will be simulated with the help of these mathematical models. What for? To determine the drug concentration present in the body. So body includes plasma as well as all the tissues, and with respect to, that is as a function of time. So this is pharmacokinetic model. So you have to define pharmacokinetic model as the pharmacokinetic model is a mathematical model which simulates the rate processes, that is absorption, distribution, metabolism and excretion. Used to, what for this models are used? Used to determine the drug concentration or the change in drug concentration in the body, which includes plasma and various tissues, as a function of time. As the time changes, like we administer the drug, like orally if you administer the drug, in plasma you can find with respect to time, as the time passes the drug concentration will increase after administration. Whereas in case of intravenous means directly you are administering the drug into your blood, that is into systemic circulation. So initially the drug concentration in the blood will be 100%, and as the time goes on the drug concentration decreases with time. So there is change, either increase in drug concentration or decrease in drug concentration. How much increase or decrease takes place, that has to be determined, and it is the increase or decrease takes place with respect to time. As time changes, the drug concentration also changes. That have to be studied using this pharmacokinetic models. Now what is the purpose of using this pharmacokinetic models or the objective of this pharmacokinetic models. First and foremost is to determine the drug concentration and then to optimize the dosage regimen. What is that optimizing dosage regimen means? Now the dosage regimen includes dose as well as dosing frequency. Dose means how much amount of drug is administered, whereas frequency means how frequently or how many times, like 3 times a day. 500 mg of tablet is taken 3 times a day. Now 500 mg is the dose, 3 times a day is frequency, dosing frequency. That combinedly known as dosage regimen. So you need to optimize. Like optimizing means it's not same for all. Like there are different categories of patient depending upon age, body weight as well as the disease state. Like in age, we have pediatrics, adult and geriatrics. Pediatrics includes children, whereas adult, the normal group of people, age group, and the geriatric means elderly patient. So the dose will not remain same for all these 3 categories. There you have to optimize. See, adult dose will be the normal dose which will be mentioned in the label. But if you need to give that same formulation to the pediatric person or a geriatric person, then you have to reduce the dose. How to reduce the dose? The dosage regimen have to be changed. Either you have to reduce the dose or you have to reduce the dosing frequency. That is known as optimizing. So for different type of patient, we have to administer the different dosage regimen. So optimizing dosage regimen for individualized patient. Individualized or personalized person means that is including pediatric, geriatric patient, also disease like hepatic disease, renal disease. That is, if there are disease in liver or kidney, then it is impossible to eliminate the drug from the body. It will be reduced. The ability to eliminate the drug from the body will be reduced when there will be disease in liver and kidney which are responsible for elimination of drug. So there also we have to reduce the dosage regimen. There also we have to go for optimization. That calculation also can be done with the help of this pharmacokinetic models. So next is we can determine the bioavailability and bioequivalence. Now this is the next use of this application of this pharmacokinetic models. So this can be either known as applications or purpose or objective. So applications may be to determine drug concentration in a normal patient and then to optimize dosage regimen and to determine bioavailability, bioequivalence. Then we can determine the drug interactions. If there are any interaction between the drugs, that also can be determined using this. And also if you administer multiple dosing, in that case also you can determine the drug concentration. So all these things can be determined with the help of this pharmacokinetic models. So these are all the applications of pharmacokinetic models. You can determine drug concentration, you can optimize the dosage regimen in individualized fashion, then you can determine bioavailability and bioequivalence, and then you can determine the drug interactions which may affect the pharmacokinetic parameters, and ultimately multiple dosing. These are all if you administer in single dose or as well as if you administer as a multiple dose, then also we can determine the drug concentration that is present in the body. So this is the application of this pharmacokinetic models. Now before moving on to individual pharmacokinetic models, we should know the classes of pharmacokinetic models. What are the different types of pharmacokinetic models are there? So pharmacokinetic models broadly divided as model dependent methods and model independent methods. So either it includes some models or it may not have any model. So a model dependent method and model independent method. Now the model dependent method will have 2 models, that is, one is compartment model and another is physiologic or perfusion model. So see, this is important in case of examination, like in short notes as well as in long answers. This may come. If it would have been asked like classify pharmacokinetic models and explain either all or any one of the model, then you should know to explain. First of all, you must classify. Define pharmacokinetic models, then mention the applications, then you can classify. Classification includes model dependent and independent method. Model dependent method will include this compartment model and physiologic or perfusion model, and independent method will include non-compartment methods. So the third method is non-compartment method. So generally 3 models are there: compartment models, physiologic or perfusion model, and the third method is the non-compartment method. This is all the 3 pharmacokinetic models are available. And under this compartments, there are different compartments you might have heard already in train. Train compartments are there, like B1 compartment, B2 compartment, B3 compartment, or like in sleeper S1, S2, S3, like that we have different compartments. So depending upon the number of compartments, this compartment model is further classified as 1 compartment model, 2 compartment model, and multi-compartment. More than 2 is considered to be multi-compartment model. And this physiologic model, again, it is based on the blood flow rate dependent, blood flow rate independent. So non-compartment analysis mainly includes MRT and anything else. So compartment model is considered to be, again, depending upon the number of compartments. If it is 1 compartment, then 1 compartment model. If there are 2 compartments, 2 compartment model. And if it is more than 2, then comes under the multi-compartment. Again, this multi-compartment can be classified as catenary model and mammillary model. So this is the classification of pharmacokinetic models. One is model dependent, model independent, and compartment, perfusion or physiologic models, non-compartment models, and under compartment they are 1 compartment, 2 compartment, multi-compartment, and multi-compartment further classified as the catenary model and mammillary model. So if you need to classify, you have to classify like this. So let me start with the compartment models, but I am not going to discuss all the compartment model details. I will discuss in the next video individual compartments as well as the individual models. So I will just give a brief idea about this models, different models. One is compartment model, then we have perfusion or physiologic model, and of course the fourth one is non-compartmental analysis or non-compartment method. So compartment models, already I said, like train compartment, we have different compartments. Like how many compartments? Whole body can be divided into different compartments. If it is whole body is considered to be a single unit, then that is 1 compartment. If whole body is divided into 2 compartments, then that is 2 compartment. And if it is 3, then it is multi-compartment. Got it? So compartments, how we are going to divide the body into different tissues. So generally different tissues will be placed in different compartments. Generally always plasma will be in the reference compartment, and generally there are compartments like first most compartment is central compartment or reference compartment. If it is 1 compartment model, it will have only 1 compartment which is central compartment or reference compartment. If it is 2 compartment model, there will be second compartment which is known as peripheral or tissue compartment. And if there are 3 compartments, this peripheral or tissue compartment will be further classified as shallow tissue compartment and deep tissue compartment. So the compartments, depending upon the number of compartments, if it is 1 compartment, only reference compartment will be there. And if it is 2 compartment, 1 compartment will be central compartment and the another compartment will be peripheral or tissue compartment. And if there are 3 compartments, 1 will be central compartment, another will be shallow tissue compartment, and the third will be deep tissue compartment. This tissue compartment will be further divided into 2. So totally 3 compartments will be there. Now how this compartments has been divided? So on what basis the tissues are placed in a compartment. So generally in central compartment, plasma will be always there. See, if it is one compartment, two compartment or three compartment, either of any compartment models, plasma will take the place of central compartment. It will be always plasma will be placed in central compartment. And what other tissues can be there in central compartment? In case of two compartment model, along with the plasma and all the body, whole body will be in the central compartment in one compartment. Whereas in two compartment model, the first compartment will have plasma, along with that the highly perfused organs. What does it mean, highly perfused organs? The organs which have high blood flow. If the blood flow is more to some organs, those can come under the first compartment, and the second compartment will have the less perfused organs. Whereas in three compartment model, we have three compartments. So first, of course, it will be plasma and highly perfused organs, and second will be less perfused organs. Deep tissue compartment will have very less perfused organs. So there are some organs which will have less blood flow to that particular tissues. So those will be in the third compartment in case of three compartment model. Got it? So we have three type of compartment models. So on what basis we have placed these organs here? It is, one is based on blood flow. We have talked about perfusion rate. So one is based on compartments can be divided based on blood flow to that particular tissue and also the permeability of the drug to that particular tissue. How the drug is permeated, whether the drug is freely permeable or very diffusible, that is less permeable to that particular tissue or the organs. That also decides that tissue to be in first compartment or second compartment or third compartment. So how we will segregate the tissues in different compartments? Based on blood flow, and second is based on the permeability of the drug to that tissue. So compartment models, mainly these are all the compartment models. I will explain detail in my next video. So the next model is physiological or perfusion model. So this model is solely dependent on the blood flow. How the blood flows are? Like we have arteries to carry oxygenated blood to different organs and veins to remove the deoxygenated blood from the different organs. So this movement of the blood will help or enhance the drug input and output to the organs and from the organs. This has been explained by this physiological or perfusion model. Perfusion means blood flow, physiology means the organs, which are all the tissues, different tissues. So how the blood flow takes place to this different tissues or the organs will help in explaining the drug concentration moving to this organs, has been explained by this physiological or perfusion model. And the third model, of course, it is non-compartment. Matlab, it doesn't have any compartment. It has no assumption of any compartments. In compartment model, we assumed the body to be a compartment. But in case of non-compartment, we don't have any assumption of compartment. Here we use some statistics. We are going to use statistics to determine the pharmacokinetic parameters. So mainly based on statistical moment theory. So non-compartment analysis mainly based on the statistical moment theory. Why we are using statistics? Because if you just check the rate, that is, as the time changes, the change in concentration. If you check the rate, the curve obtained is similar to that of particle size distribution curve. This curve is known as distribution curve. So which can be explained by statistics. So as we are getting the distribution type of curve, we are going to use statistics to determine various pharmacokinetic parameters, that is used in non-compartment analysis. So non-compartmental analysis includes statistical moment theory, where you are going to determine MRT, which is mean residence time, average time the drug resides in the body. The time required for, the average time required for a drug to reside in the body is known as mean residence time, that can be determined from AUC and AUMC, which I will discuss in further videos. So this is just a general idea about the pharmacokinetic models. In my next videos, I will be discussing individual models like compartment models means what is actually the compartment model, what all the assumptions are there, what does it mean 1 compartment, 2 compartment, 3 compartment, how the movement and exit takes place in the body depending upon the drug, and how the curves will be explained. That will be discussed in our further videos. So we are today discussing about the general classification of pharmacokinetic models, which includes 3 models. One is compartment model, perfusion or physiological model, and third is non-compartmental analysis. So we'll further discuss the detail in further videos. Thank you.